Hello, in this video I explain you how to use the QRS for when you are suffering from chronic asthma. The protocol that I describe in this video is not just relevant for asthma, but is also relevant for all other obstructive pulmonary disorders, such as, for example, bronchitis, COPD, or for example, pneumonia following the infection with the COVID-19 virus. So if you are suffering from asthma, then I strongly advise you to use the QRS on a daily basis. And first of all, from a preventative point of view, use it as a complementary therapy, and you're going to see that the number of acute attacks is going to be substantially reducing. So if you're going to use the QRS on treating asthma, what you're going to use is the QRS pillow applicator. You're going to hold that connected to your lungs and also a little bit connected to your throat area. So don't let it sink too low, because the key thing is that it has to connect to all your lungs, including the so-called alveoli, which is the end points of your lungs. You can also hold it like that. You just hold it like 24 minutes to 40 minutes is already more than enough. Don't overdo it. So now I go to the control unit, the QRS control unit. What program do you have to set? And you're going to set on the control unit, you're going to select the frequency program basis, which you find on the left hand side on the middle, and for the intensity levels, which you find on the right hand side, you're going to select either level 5, level 6, 7, 8, 9 or 10. Remember, level 10 is this intensive button, so in case of doubt, in case you really want to be sure about the effectiveness, basis intensive is always going to help you, especially if there's a lot of inflammation. That basis intensive really hits in the inflammation. However, there's two buts. Please remember that the basis intensive is much more intensive than you think. So don't overdo it. 24 minutes, 40 minutes is really more than enough. I said it already before. Also, drink water before doing basis intensive. If you do not do that, you could get some dehydration, you could get a little bit dizzy. And also, if you have an underlying heart disease, I stress that QRS is 100% safe. So even with an underlying heart disease and you use basis intensive quite close to your heart area, there is no risks. However, and that is my second but, you're going to see already the effectiveness. You don't always have to do that basis intensive. Basis medium, for example, remember medium is level 5, is often very effective also. So you can also start with some lower program, basis medium, especially if you want to use QRS to treat asthma in children. I advise you to do basis medium, a fantastic program, or even lower, like level 4 or level 3 will often also see a positive effect. So what are the effects that you can expect if you use the QRS for treating asthma? First of all, I already said that the number of attacks and the intensity of the attacks is going to be substantially lower. But already after the first session, really 24 minutes, 40 minutes, I keep stressing it, you're going to feel some strong improvement in your oxygenation. You really are going to breathe way much better, not just a little better, you're going to breathe way much better. Your alveoli, they are binding with more oxygen. They are exchanging better the oxygen and the CO2 with your arteries. The next thing, inflammation is going to go substantially lower. And remember that asthma in the core, it is chronic inflammation of your airway. So that inflammation really, in 1 session, 2 sessions, 3 sessions, you see significant improvement in the reduction of inflammation. Also, the muscle spasms that asthma patients are often suffering from, the spasms, the contractions of your airways, that's going to be less. Your smooth muscles around the airways are going to relax more, and there's other benefits, like for example, if you suffer from long-term asthma, you probably suffer also from edema, and that edema is also going to be resolved very quickly from using the QRS. Last but not least, there's many other benefits, but I want to keep this video short. Last but not least, you're really going to see already in 1, 2 sessions, 3 sessions, that you can stop almost completely with all the other medication and therapies that you are using. For example, the bronchodilators, really after you starting with the QRS, you do not need them, and more importantly, all the corticosteroid medication with all the side effects. Really, the QRS is going to be equally or even more effective. So very important, you are going to reduce the side effects. QRS, I stressed it in many videos, is a therapy without side effects. This brings me to the end of this video. I hope you liked it, and if you liked it, then click on the like button, but more importantly, the like button is actually down. But more importantly, if you liked this instruction and you want to have more instructions on all the various diseases, on exactly how you have to use the QRS, this is the official channel from the QRS corporate head office in Germany. This is the only channel which has all the information on how to use the QRS. So please subscribe. I will be thankful for your subscription, and I am thankful for having watched this video today. Thank you.